Here we are. Day 2 is coming to a close at the dance, the Dental Assistant National Conference for Excellence, and I have somebody special with me now.
Yes.
Okay, so not only are you a dental assistant, but your doctor went out of their way to submit in writing why you deserve to get an award, right?
Yes.
So she had nothing but glowing things to say about you, right?
Correct.
And so is this is the award? You should show it off because it's
Yes.
kind of a big deal.
Yes. This is the award I won yesterday. I had no idea when I forwarded the email to my doctor, and I was like, you don't have to do this. I just, want to give you the option, and I was kind of like, there's a free night, so if I win, I'll get a free night out of it. And so that's the last I thought about it, and then yeah, yesterday came and I won, and I was like, yeah, a little nervous getting up there, but yeah, it was it's pretty
So
pretty
now, what's the
fantastic.
award called?
It is called the Eileen Ahern Dental Assistant of Distinction Award.
And did Miss Jules or one of the girls tell you why she was named for that award?
Why Eileen was named
Yes.
for the award? So I was in the moment. I was a little
everything's like a
nervous.
blur.
Yeah, so I know she was a very long time dental assistant, and she got the award because she was pretty fantastic.
Yeah, well, I mean, she exemplifies what we all want, right? To think of it as a career and not a
Yes.
job, and to dedicate our lives to continually doing better and
Yeah.
being better for our patients, for our doctors, for our teams.
Yeah.
And your doctor thinks you're pretty fantastic. I think you're fantastic. Everybody in that room says, you know what? You're pretty fantastic. I mean, the whole idea that you came out of your way to a dental assistant conference to learn more about dental assisting specific stuff. And I think that's the key. The minute you start thinking about work when you're not at work, magic happens.
Yeah.
And it sounds, okay, so tell us about your practice. What is your normal role day to day as a dental assistant at your office?
So normal role, I mean, when I come in, I'm pretty much there I'm pretty much there for everyone, but specifically the doctor and the
Right.
patients. So doctor first, but patients are a very close second. So just making them comfortable. I try not to judge. I mean, everyone has a different background, so you just never know what someone's going through. So when they come in, it's, I'm meeting them for the first time, and I want to hear their story. So
Yeah. And so, what do you think you've learned from the conference, other than how rock star you are? Because you got
Yeah.
an award now that says "I'm rock star,"
Yeah.
literally in glass.
yeah.
But what do you think you've taken away from the conference so far?
Oh my gosh.
That you could literally go to work on Monday and be like, "I learned this. It's new, and it's going to make me better, so I'm better for the practice."
Yeah. Today, with just the infection, what am I talking about? I lost track.
There was a lot. We have
I know.
Care Credit,
I know.
On Point
Care
Space.
Credit.
Zen Supplies is up now.
Yeah. So, basically, it was kind of infection control and just how we should be running our sterile and what the right way is, and coming in new as a dental assistant, I didn't really know those things, and now I feel like I can incorporate more of what we should be doing.
Yes.
So.
Well, because we've always done it that way. It doesn't work. And the whole idea of paper up, paper down.
Yeah.
It is literally like, it's been the battle throughout the centuries for dental assistants. I can't tell you how many times I see it on social media. Oh, your mid-marks, paper up. No, it's paper down. No, it's paper up, paper down. No nails, no nails. Like, it's just like
Right.
these random things that, it's all kind of gray.
Yes.
And then you have a conference like this that's vetted just for assistants, and it's black and white.
Yeah. Yeah, I know. And, sometimes I'll ask, why do we do this?
Yep.
Well, because the other assistant, this is how she did it.
Yes.
And well, now I know that's not the right way. So, so I'm really thankful to be able to take a lot of this back.
Yeah.
And
Well, what's funny is like just the other day I listened to a dentist and he said my dental assistant put my electric handpiece and the ultrasonic. What do I do? I'm like, okay. Or you hear about it all the time. My dental assistant was using tap water to fill the or to fill the mid mark or whatever he had, some kind of a. I'm like, okay, Will.
Yeah.
That's going to be a lot of, and it was funny because like there was a lot of information that after the fact, but wouldn't it be easier to avoid the sediment in that tank of his sterilizer if his dental assistant was trained properly not to put tap water in it?
Yeah.
Yeah. That'd be really cool, right?
Yes.
You know, so preventing by promoting education.
Right. Correct.
Yeah.
Yeah. Yeah.
So, okay, what's your favorite part about being a dental assistant? Before I let you go,
Yeah.
so you can go sleep with your glass
Yeah.
award here.
So favorite part. I really do love it all. Just the patients, actually.
So the chair side, like
Chair
being
side.
able to be their compassion warrior.
Yeah, and I really like it when I can read my doctor's mind before she tells me what she needs. So
Anticipation.
yeah.
It's not an accident, guys.
No,
Turns
it's-
out there's a science to it. We
Yeah.
learn how you want things, and then we do things that you want.
Yes. Yes. So yeah. So it's I really loved. Like I said, I started in the front, and
Right.
so I've now made my way toward the back, and that's
Which is kind of polar opposite because a lot of the DA's journey, it's from the back to the front.
yeah.
So it's kind of neat because now you have enlightenment that you can give to the DAs in your clinical aspect of your clinic.
Right.
And then be like, oh, well, you know, don't worry about that. That's how she's going to file this, or that's like, it's kind of neat because that little crossover there. And we saw when they were talking about cross training.
Yes.
Like you're
Yeah.
kind of like the poster child for that.
Yeah.
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 That's really, really cool. Well, thank
Yeah,
you so
thank
much
you.
for spending some time with DentalCast and coming to the dance 2019
Yeah.
because it's the first of many.
Yes.
And
I'll be back
so
next year. So
Tell your friends.
yeah.
Have their friends bring their friends' friends.
Mm-hmm.
And then everybody bring your doctors so we can learn together as a team.
Yes. You
Yeah.
hear that? Bringing you next year.
We're a team. You're doing
Yeah.
this. Thank you so much.
Thank you.
Bye.
Bye.
Whew, gotta show that thing off.
Oh yeah.